Good morning, Dr. Gregory Page, living here in Hawaii, and I wanted to talk a little bit about toothbrushing. And I want to first just give a brief introduction on why you want to brush your teeth. Okay, bacteria, what they do is they attach to your tooth. Then, if they're left there for 3 to 10 days, calcium bonds to the bacteria. Then bacteria bond to the calcium, calcium bond to the bacteria. That's tartar. That's a hard material. It's not soft. Plaque forms on the teeth with food and bacteria, but that's soft. That can be brushed away. But if it sits there for 3 to 5 days, it starts to calcify, and it's hard to remove with a toothbrush and floss. So you want to brush your teeth regularly, at least once a day, maybe 3 times a day is good after each meal, so that the tartar or plaque that's on your teeth doesn't calcify. And then it's hard to remove, and you'll feel it. Your teeth will feel rough. They won't feel smooth and clean. So bacteria are causing the problem. Now, when bacteria build up on your teeth, what they do is they eat sugars and starches, like carbohydrates, potato chips and corn chips and all this crud that people eat with high fructose corn syrup. It feeds the bacteria, and the bacteria excrete acids, okay? Just like we go to the bathroom, bacteria give off acids. The acids soak on your teeth and demineralize the teeth. So that makes holes in your teeth. It starts very slow and small, and they get bigger and bigger and bigger. So by getting rid of the bacteria, you're lessening the acid that's on your teeth, okay? Now, if you brush your teeth in the evening, that's good, because then all night your teeth aren't, soaking in high concentrations of the acid, because the bacteria are working all night. So if you remove the bacteria from your teeth in the evening, then you go to sleep, there's less bacteria in your teeth at night, less acids on your teeth, less decay, less gum problems. So the acids on your teeth also irritate your gums. The gums detach from the tooth, get red, bleed, pussy, and that's gum disease. So you want to clean the bacteria from your teeth. The easiest and least expensive way to do it is with a brush and floss. And what you want to do is angle the bristles of the brush on a 45-degree angle between the two, half on the tooth and half in the gum, and just wiggle, and then move and wiggle. So you just wiggle, move, wiggle, move, wiggle, move. Now you also have to do the tongue side. So you would angle it at the same angle, wiggle, move, wiggle, move. On the front teeth here, you can do it like this, or you can do it like this. Now, of course, you would do, you have to wiggle and move all the way around here. Now, for flossing, let's show that real quick. What you do is a nice big piece of floss. It makes it easier. You wrap it around your middle fingers until you have about 3 inches between your fingers, and you're guiding with your index fingers. Then you go down between the teeth, wrap around a little bit, up and off. Down between the teeth, up and off. Now, I have another video that shows this in more detail. So take a look at my page and some of my other videos, and share it with your friends also. Make comments. I would like to hear what type of brush you use. The 3 main brushes that I know of are Sonicare, excellent piece of equipment, a little expensive, but it works really good, easy to use. Then there's a spin brush by Colgate. That's an excellent piece of equipment also. Maybe not quite as good as the Sonicare, but a lot less expensive, but it works very, very good. And then there's brushing and flossing. That's the least expensive, but it takes the most skill and time to do. So that's why the Sonicare is probably one of the better bets, because it's easier to do, so you're more likely to do it, okay? Compliance, it's called compliance. So if you comply with the 2 or 3 times a day, it's going to be easier with a Sonicare than it is with brushing and flossing. Now, when you start to learn to floss, it's going to take 10 or 15 minutes to floss your teeth, and you're going to get a little annoyed and blah, blah, blah. But if you do it every day for a week or two, you're going to be able to do it in a few minutes, and it'll clean your teeth better than anything out there. It's the best. So let's talk about decay. So again, decay is where acids given off by bacteria on your teeth dissolve the teeth and the gums. Okay. Now, when it dissolves the teeth, it demineralizes the teeth. It pulls the minerals out of the teeth. The acids from the bacteria pull the minerals out of the teeth, and that makes holes in the teeth. Now, you'll, if you go and you read or listen to some of these TikTok videos, they'll say, "Oh, teeth can regrow." No, teeth don't really. I mean, if you lose a tooth, you don't get a new one. That would be regrowing a tooth. They make some valid points on these videos that saliva is very healthy for your teeth, and using, brushing with the teeth technique I taught you with just saliva is the most effective. But you got to have fresh breath and, social situations. So you use a toothpaste, brush your tongue. That works really good. But the teeth don't really grow back. So how can you so what you can do is if the teeth are slightly demineralized, just a little bit, the very beginning of decay, the very beginning of a hole in your tooth, it can reverse. And the way it would reverse is you have to provide some form of calcium. I mean, maybe cheese and milk would do it, but I don't think so. They do have some toothpaste now that have, this hydroxyapatite or something similar in there that supposedly remineralizes the teeth. I haven't seen the research on it yet. So, but I do know that fluoride will remineralize the teeth, and the tooth structure that's formed when the fluoride bonds into the tooth is stronger than the original tooth structure. So you're getting a little tiny hole in the tooth. It has to be just in the surface very early. And then you start brushing with a strong fluoride that's prescribed by the dentist. That'll remineralize, and actually the hole in your tooth, it's not really a hole. It's just a demineralization, like some of the calcium's washed out of the tooth. That will actually, the area that's demineralized will fill with fluoride, and the fluoride structure that's formed will be stronger than your original tooth. Now, they say, well, fluoride, oh, it's the devil. No, I mean, yeah, it's a neurotoxin, but, so are most of the drugs people are taking, prescription drugs, and they're taking it every day, putting it into their system. This is, with fluoride, you're just using it on the surface, you're using it temporarily, you're rinsing with it, and then you spit out the excess. So you're not supposed to drink the stuff. You're just supposed to put it on your teeth for a minute or two and then get rid of it. Some of the healthiest gums and teeth I've ever seen is with this ACT, A-C-T. It's a fluoride rinse. It's not even prescription, boys. That stuff work. Now, again, you don't want to drink that. You don't want your kids drinking that. But if you're rinsing with it once in a while, it's not going to really, I don't know. I think it's going to be way less than vaping, way less dangerous than vaping or smoking or drinking coffee or even tea. I don't know. Green tea now has fluoride in it, so they're proving that there is fluoride in green tea. Again, it's at such a low concentration, I don't think it's going to hurt you. So your body can process some of that. So, am I saying that you should use fluoride 50 times a day and, swallow the excess? No, don't do that. Just use it once a day before you go to bed at night. I would get a prescription level from your dentist if you can. That would work the best. Anyway, so that's my ideas on fluoride. It's not very popular these days, but your teeth can't regrow. So anyway, thank you very much. That's it for today, and I hope you all have a happy weekend.